So let's begin the session. So I'll be talking on plan, prepare, and conquer your exams. So I'm an ex-alumni from LVPM. So most of the contents of these slides are actually taken from an interview of Dr. Pranesh Balasubramanian itself with the gold medalist Dr. Harika, Dr. Shashwanti, and Dr. Sanira. So initially in the first year, all of you will be having these doubts like, should I get all the books? Should I read the reference books also? How should I read? Should I read every day? Or should I start reading for the exams from now itself or for knowledge? Should I start reading those articles because all my seniors are reading those articles too? So I would say when the initial phase, it's always better to start from the basics, build your basics. So the best book for the standard definitions is Parsons because examiners are very fond of asking the definitions and also the clinical science also. So for that, the best thing is to read Parsons. And as we all know, Kansky is our library. It has almost everything very comprehensively. You have to read the Kansky. You have to read Kansky and revise it multiple times before exams. There is no other way to it because your eyes will see only what your mind knows. And in the initial part, I think it's better to start case-wise. This is what being done by all the gold medalists and normally everybody. So start with cases or maybe science. Like if you're seeing a keratic precipitates on the first day, start reading about it. So you can be more thorough about what is there and what are the different patterns in which KPs can be seen. So you have to start early and stay focused. Keep a scheduled time every day. Try to read every day. Maybe you can start with 30 minutes a day, slowly build up to 1 hour. At least reading for 1 hour every day, you'll not feel that guilty. And it's always better to learn from your clinics. Never miss any opportunity to see interesting cases. You have to stay focused and organized. You have to start making notes initially itself. So when you're making notes, prepare them systematically. Keep one book for retina, one for cornea, one for cataract like that. And whenever you're writing everything, you have to leave pages because you'll have to read and refer more articles and you have to add on to these notes because especially for the frequently asked questions and common exam practical cases. For that scenarios, you have to read and to add more. So this is a photograph of the book of Dr. Harini, who is a gold medalist. See, she has got a different book for retina, and in that, in the first page, she has given the table of contents, the page number, and when she has revised that, she's putting tick marks. She has got a proper strategy of how to read also. So this is a notes on CRAO, wherein she has added sticky notes when she is referring more, she has read and referred more and she is adding that also to it. And for some topics, I think this reading Kansky will not be enough. You'll have to refer to some articles also. So whenever you are reading from some articles, it's always a better idea to take a photocopy of that article and stick on to the notes, adjacent to the notes, so that finally when you're preparing for the exam, you'll forget from where you have read about it. So if you're sticking your articles also along with your notes, it will be easy for you to refer. For some topics, especially for eyelids and for lacrimal gland, dry eyes and all, this Kansky is not enough. You'll have to refer to articles, AAO articles and all. So this is, I'll be giving this in the handout. So topic-wise, from where to read more. Now, in the next phase is when you go to be an exam-going PG. So when you become an exam-going PG, this is a dreaded phase where everybody will be pointing towards you, referring to you to answer all the questions. So then you have to start preparing a newer strategy. You will have to slowly increase your study hours per day. First of all, you have to get the question bank. Either try to get it from your university sites itself, or for the DNBs, it is available in the iDocs platform. And the books which you have not read, like the basic sciences, the Kurana, anatomy and all, start reading that so that you'll not panic at the last. And also start preparing for the case presentations. Now the most awaited study holidays. When the study holidays come, you have to make a proper timetable. Mind you, study holidays is only for revision. Few institutes may not be allowing study holidays also. So make a proper timetable. You have to read the topic at least once before the revision part. And for the volatile topics like the optics, for me it is optics and all, it's always better to keep the volatile topics towards the end. Once you start writing a theory paper, the main dictum is be very crisp, keep a format. Dr. Shashwanti, she was our senior, she told us that the examiner is not going to read everything, you are going to write pages and pages. So you have to be very crisp. And the clinical features, the discussion part and all, just make flowcharts. Always keep 1 or 2 flowcharts in your theory paper for each question, and just be very crisp on the what you know, because the examiner just want to know that whether you know the things. He don't want the discussion part of it. And the main thing, the mark fetching part is, whenever you are adding anything on a journal, just put the et al, highlight it so that the examiner will surely see that you read this article and you are citing from that. And also, when you are writing something about the recent advances, whenever you're reading or writing or anything regarding the recent advances, put a proper box, underline it so that the examiner will see that and will notice that you have read it. These are the mark fetching points. Otherwise, everybody will just give the basic marks. They're not going to read throughout your paper. Always use highlighters, or you can underline. It is allowed actually. And always draw big diagrams. When you're drawing diagrams, it is always better to leave spaces above and below so that the paper looks neat. And try to label only on one side. Don't scribble and label on each side. It will not look neat. Be legible. Good handwriting fetches you marks. But if you don't have a good handwriting, that is also okay. You just have to leave inner spaces in between. You have to write big. By that, your paper looks more neat. And there is a pro forma, how to write for each questions. For the clinical questions, start with the history, incidents, definition, etiopathogenesis, etc. And for investigations and instruments, again use indication, optics, etc. This will be given in the handout. And start practicing, because by the time by finish of PG is almost 3 years, we'll lose the habit of writing for 3 years. So it's always important to start practicing at least 2 months before the exams. You'll have to, most of the institutes will provide mock tests, but if your institute is not providing mock tests, sit in a group of 2 or 3 and start self-testing with old question papers. Because you have to have this habit of writing for 3 years, otherwise you will just get tired of it and you'll stop writing because of the pain, and you'll feel like just scribble something out and finish it off. So it's always better to start writing. And practice time management also. Most of the time what happens is when we see the XA questions, we stop, and if it is a question which we know very well, we'll go on writing about it, and finally you will miss out on 2 or 3 questions at the last. Mind you, especially for DNB exams, if you are not able to properly write 2 questions, you'll fail. So always make sure that you are going to write each and every question. So for proper time management, you just leave spaces. If you want to write or add more, there will be time. If you don't have any theory classes at your institute, no worries, especially for the private institute, may not be having theory classes. There are many online theory classes platform. The Arvind Eye Hospital has got classes which is available on their Oro Tube channel, wherein they also provide links for attending their grand rounds also. Even iFocus has a program. So I'll be detailing on these things. So this is the site of RP Center, wherein they have a detailed schedule of the PG refresher courses. They will give you topics. Once you join and subscribe to this channel, they will give this timetable of when there will be classes, and you can attend this. The RP Center is the only center which actually gives classes for this instruments also, because usually nobody tells us regarding instruments. These instruments, how to differentiate between them, their uses, everything will be detailed. There are classes taken by senior consultants also, and also by their senior residents. So I have attended these classes for instrument. It was really useful. Even Shankara Eye Foundation takes classes on the recent advanced topic, the IC3D classification, the glaucoma drainage devices. I have not seen these classes being taken by any other YouTube channel. The Shankara Eye Foundation has got all these classes, especially on the recent advances. This is a very good platform. So if you don't have these classes being taken at your institute, just go and click this YouTube link, subscribe to this channel. This is very good channel. Now coming to LVPA, this is their platform, LVPA Digital Education Platform. You just type this in Google and you will just go on to their site. They've got a lot of programs, especially for the postgraduates. These are the JAM articles, and you can also access their LVPA grand rounds. Grand rounds are nothing but, this is a clinical case presentation. Along with the case presentation, there will be viva, like questions being asked by the consultants, and you can actually listen to their grand rounds. This will be the rarest cases, and it is very interesting to attend these. And then they have this attention to retention program, and also you can also directly attend their webinars also if you go to this site of LVPI Digital Education. This is one of my favorite classes from LVPI, problem-based learning classes. They will take some topics. This topic, I would recommend each one of you, please go and attend this one by Ashi Morowala. This is the best topic being taken in a very systematic way. So here they will be asking questions, and they will only ask questions, and they will only clearly make you understand each and every part of it. And this is very important even for the FRCS also. For the FRCS, the Viva questions, that also will be discussed in this PBL platform. This is very good for that. They have a lot of topics being covered in this problem-based learning. This is available in the LVPA Digital Education platform. Next is this U&I program, where there will be classes being taken by the legends itself, like Tarjani madam and all, and there will be their fellows and residents who will be asking questions to madam, and she will be replying to that, and she will be asking questions to the residents. So it is like a digital Viva voicing. You can just listen to that. And these are the attention to retention programs, which is also available free in the YouTube channel of LVPI. Again, the same site, LVPI Digital Education, where they will be covering each topic, like the Fuchs, uveitis, everything, management algorithm, the current management algorithm for keratoconus, then the ocular myasthenia, newer treatment modality, everything is there, whichever will be asked in the practical exams. So that all things will be covered. These are short videos, just 5 minutes. So it is easy for you. You don't have to sit for long, just 5-minute videos. Whenever you are taking a break in between your study time, just listen to one video. You can get the newer points, newer things, and just add on to your note. Now comes the phase of the dreaded practicals. So the main dictum, the tick being given by every gold medalist is be calm, composed, and confident, which never happens because everyone will panic. But mind you, the confidence comes only from seeing the patients, examining the patients. So never miss clinics. Try to attend the clinic and try to learn from your seniors. Every institute will be having a different case performer. So I think before the exams, you should be by heart that very clearly. And while answering, be audible and to the point. And be very humble. If you don't know, just say don't know. Because if you beat around the bush, they'll just keep on poking you. They'll make sure that you cry. Till that, they'll keep on asking you. So if you don't know, just be humble and say, sir, I don't know that. That's enough. And keep practicing, especially how to present the cases. You have to practice. Try to practice. Like when we were preparing for exams, me and my friend, I will present a case. She'll just ask the questions which is there in the FAQ Aravind book only, nothing else. She'll just like randomly ask 1 or 2 questions, and I'll try to answer that. Then she will present the next case, and I will ask her 1 or 2 questions. So that at least by that we have that practice of how to go and present for the examiner. Because so especially for DNB exams, if you are going to a place where you don't have, like nobody will be there to help you out. So it is better you practice that also. And whenever you get a chance to present cases, try presenting cases. This iFocus program, they will actually invite hot seats. If you just subscribe to their channel, they will send you emails, and they will put the heading will be hot seats. So you have to apply for the hot seats. They will give a Google Forms platform wherein you can apply for which hot seat you want. Like if you are weak in cornea, or if you feel like you are weak in optics, just tick the hot seat for optics. So if you tick for that, they will call you and ask you, like they have a session coming on, will you be there? If you want to be there in the hot seat, then just say yes to that, and then they will call you. During that session, there will be not just you, there will be minimum 5 to 6 hot seaters, and you can be among them. And during that time, whoever is presenting will ask you questions. So you have to prepare yourself for that, but by doing that, you will get the practice of answering your Viva voice key very nicely. So books to read for practicals. There are a lot of books, but I think these 3 are inevitable. But one thing I would say about this book, everybody will be reading this Aravind FAQ. It's a wonderful book, but this is very volatile. So when you're reading for a topic, first read from Kansky, build your base, then go to FAQ, and then just mug up the question wise. Because if you're doing the other way out, if you're reading FAQ first, you will just forget everything. And this book by Recent Advances by H.V. Nema is also very good. And even this book by Prafula Kumar Maharana sir and Namrata Sharma also is very good. So these three you should must read. And when you're preparing for practicals, try to sit in groups. For some people it will be difficult, but still try to sit in groups and study. Ask for help from your seniors or the junior consultants. And when you know a topic very well, try to teach others, because when you're teaching others, we teach ourselves also. For the practical, I would say this site, this link, I'll give you this link. For this iFocus link, iFocus has got a proper strategy of OSCEs of each topic for retina, cornea, everything, where they will be discussing on the OSCE platform. This is very good, especially for DNB exams and also for FRCS. When you're preparing for FRCS also, this is very good. And iFocus, this program also has sessions on pathology and microbiology. These are sessions which will not be covered in any of our institutes, and none of the seniors also will be knowing that. They'll just give you some slides and just say some marks on the slides to mug it up. But when you're preparing for FRCS exams, or when you're going for DNB practicals, you won't get ready-made slides. You will be getting different slides. So this classes which were taken by Lalitha Prashna ma'am and Ritu ma'am was very good. I had attended these classes, and they will just clearly tell you what to look for in each slide and how to find out the case. And for refraction, by the time we reach the last term of your exams, we will forget everything about refraction. So there are these 3 classes which is available in the iFocus platform by KP sir, which is very good for a quick revision and for the practical part. And if your institute or the center at which you are, if you don't have OBSCAN available, B-scan, ASOCT pictures which are not available if you're a center, there is this study group which is known as a Spotify study group. And in that you get all the scans, there will be spotters, the OBSCAN will be there. Beneath that they will give the diagnosis also. Everything is there. Like the OCT macula, the recent pictures, the clear pictures, everything is there. So just go and join this site. From that you can get all these scans. So you'll be very confident whichever scan they give you, you can prepare and you can answer. So this is my courtesy. Mainly I've taken from Dr. Pranesh only, and remaining things from Dr. Pradeep Gupta and Saurav Deshmukh. Thank you. So before leaving, just give me your email IDs and phone number. I'll be sending all these links, the iDocs question banks, DOS articles. I have got a collection of the main important DOS articles. All these things, I have formed a folder for it, and I'll be sharing that folder. I'll give access to that folder to all those who have attended this. From that, you can get the whole thing. Thank you.
Thank you, Rakhi, for that elaborative session. Next, we have Dr. Pranesh from Aravind Eye Hospital. He has done his PG from Aravind Eye Hospital itself. He need no introduction. He is famous among PGs for his classes and his YouTube video. King Cracks is very famous. Thank you, sir.
So good morning, everyone. It's a pleasure and honor to be here. And I wish I had a senior like Dr. Rakhi to guide me through my exams. Such helpful links. I think she has covered most of things what I was supposed to tell. I'll just add on to what Dr. Rakhi has mentioned. But before that, I think you listened to previous talk. She was talking about a lot of online resources, YouTube channels. So YouTube, which is a social media, right? And social media is a double-edged sword. So before I move on, I want to ask, how many of you are residents here? A raise of hands, please. Great. Practitioners? Great. So I'm very happy to see practitioners as well. That shows the amount of passion you have to take this information to your students. So like steroids, social media, if handled not in the right way, can slay, can kill, can distract, can deviate your path. But if yielded right, a small town postgraduate can have his world or her world of knowledge in her palms and pockets. So good morning again. Welcome to this inspiring instruction course, the second talk being the online resources in ophthalmology. So my focus will be primarily on the e-learning resources. not about the patient care applications, but specific curated for you guys residents. So whatever I'm going to talk about is taken from this book which we published during the COVID times. This is called Online Resources in Ophthalmology. So this book has all the links and applications which primarily forms the more unabridged version of this talk. And you can access all these materials. You can get this ebook for free from a Google Drive link if you can scan this QR code. I hope this is being recorded. So if the audience is watching online, you can pause this video and you can show your camera to this and it can scan this QR code, which will take you to a Google Drive link where you can access this ebook. And also share this QR code with Dr. Rakhi. She can also share with the residents through the mail. So primarily, the whole idea behind this OREO or online resource in ophthalmology, we have two diverse classifications of online resources: apps, websites. Some applications will have websites and some websites will have their relevant applications as well. So both go hand in hand. Both are not mutually exclusive. So we'll talk about the applications first. So I hope people here will know from where to get these applications. Play Store for Android and App Store for your Mac OS or iOS. We can again classify applications into two. I know it's like taking a class, but it's to make things easier for us. There are two types of applications: generic applications and specific applications. Generic applications like YouTube, Facebook, where you have everything which is not needed for us, but they also have hidden gems in Opthal, lectures, surgical videos. Specific apps, specific resources which are made only for Opthal. Okay? So YouTube is going to be one of the generic, non-specific place where you can get loads and loads of information. How many of you do not use YouTube? Everybody does. Good. So Dr. Rakhi has covered a plethora of information for YouTube. I'm just going to give you two tips. First tip is this: whenever you're watching a video, save it to a playlist. This is my playlist. You can see that I have a playlist called Car Listen. So whenever I'm driving, I listen to these lectures. So share it, put it in a separate playlist. That is tip number one. Tip number two is that, tip number two is that this is going to be an 1 hour lecture. Trust me, nobody can watch a lecture 1 hour. Attention span is just 10 minutes. So you can either pause the video and watch at your own pace, or better yet, you can watch in a 1.25x or 1.5x speed. This really helps because all the lectures available out there are exceeding 55 minutes, 1 hour at least. So watch in 1.5x. Practice watching that so that you can cover a lot of information within a short amount of time. This is my second tip. So with these two tips on how to watch a YouTube lecture effectively, moving on to few channels, just want to add to Dr. Rakhi's list. CyberSite. It's an incredible channel, incredible website. How many of you know this site, CyberSite? Okay. This is by Orbis, pediatric ophthal giants. They have this flying hospital. They take flights all over the world to serve the underserved population. And they have this incredible YouTube channel where everything has been covered. Dr. Pradeep Mohanta, who again needs no introduction. OraTube. You go to OraTube for the beginning residents who want to excel in surgeries. There is a playlist on MSICS. Beautifully made animations with real surgical videos, which can be an incredible resource for the beginning residents and for the teachers and trainers as well. So having completed one non-specific or generic app, that is YouTube, moving on to Telegram. How many of you don't have Telegram? Great, nice. Nice to see people all use Telegram. Telegram is a godsend, okay? This is my Telegram channel. You can see all the books. Literally, almost every book which is being published are there for free to download and to read. The only problem is there are too many spams in Telegram. Someone will add your numbers to some other groups. But if you are focused, if you can wade through the clutter, you can find real gems, things which you can easily download for free. See, this is one of the websites which shows the actual real-world price of these books. If I'm going to buy 3 of these books, my entire fellowship salary is covered. Can I do that every month? I can't. So in our world, in our economic setting, people can tell about piracy and all those things, but come to practical difficulties, what we all face, this is the way to go. Facebook. I don't have to ask the question again. So Facebook is going to be a very tricky situation. It is not like YouTube or Telegram. It's more distracting than helpful, but there is a way. So this is my Facebook channel. So I upload all these notes and all those video links there. But one fortunate thing is that, so whenever I upload these videos, when I upload all these notes, people can access this. This is not like Instagram. Instagram is much more popular among the current generation. I know I'm sounding like an old person, but the thing is, when I came into the social media picture, which was more famous, the one which was more famous was the Instagram. But now you can see, when I have my own Facebook page, I can follow only the relevant, important off-tal Facebook pages. So when I scroll through my page, the feed in the Facebook has only these. It doesn't have what my friend visited Bali or with his wife in honeymoon. I don't have to see all those things. Less distracting, more focused. So the tip is, you can have a fake profile, create some name of your choice, and you can follow only the pages which are helpful. Then you can switch back and forth. You can switch your accounts and watch and go through only the relevant feeds for a resident. So having covered the generic applications, moving on to the more specific ones. So there are no financial disclosures. This is something which I did voluntarily. This is DigiNerve by JP, which was mentored and created by my mentor, Dr. Venkatesh Prajana sir, from Madurai Aravind. So this is going to be an application. The reason why I have videotaped these things, because you cannot screen record from this. You cannot take photographs also. Screenshots also, you can't do that. Now this is an application where residents can go and subscribe to this package. They have an incredible set of lectures taken by people, the legends of Oftal, not this person, but someone else, like the best people in the world. Krishna Prasad sir, we have Lalit Verma sir, we have Pradeep Sharma sir, all these legends who have taken pains to take this class. Okay? So this is one package which I feel it's affordable. It's not too costly, which residents can go and prescribe or subscribe to this package for a year, and they can get access to these lectures taken by all different legends and the best in the world and best in the field. They have given their efforts to take classes for you guys. And they are also having these notes. The only problem is you can't do piracy here. They're very strict about it. Even if you take a screenshot, it will send you a mail. This guy has taken a screenshot. Okay, and you can't screen record it as well. So there are some restrictions are there, but considering the price package, I felt it was okay. How many of you know this person? He is my inspiration. This guy is someone, he doesn't need any visual aid. He doesn't need all these PowerPoints. He himself, the whiteboard and the marker, he can create magic. I'm getting goosebumps when I talk about this person. Such an incredible, inspiring person. And I know he takes everything under the sun, but you can watch his Oftal lectures, which are available just for $5. I think he has given for $1, I think, some time back. He has this incredible dream to give free education to all. So watch this YouTube channel. He's on YouTube, and he has his own website where he takes these classes. You can again subscribe to this, the link of this package. You can watch these channels. One thing what I think all of you should know is this AAO. It's another useful application. And if you are a member of AIOS, you can access this AAO1 network, which gives you an exclusive access to all these videos links. Zotero is something which I hope Dr. Prithvi will cover. It's another useful application. This was a lifesaver for thesis. When it comes to thesis, there is one important software. This is not an application. This is more of a Mac software or a PC software which you can download. And you can see, you can add all your references to this. By clicking on this, there's a magic wand upstairs, up there. You can click on that. I can't show it here. It is right over there. You click on that magic wand. You can enter the ID of an article. You can get the references of that article into this library. Then, after you finish your thesis, there is this Zotero add-in is there. download that. You click on it, all the references will just come like that. No need to waste your time in adding references now and then. Completing the websites, going for the important websites. First going to be the cyber site. Like I said, there is a relevant YouTube website as well. The second website is called as iLearn, what Dr. Rakhi has mentioned. Third is iGuru. Fourth is iWiki. So remember these 4 I's. iLearn, iGuru, iWiki, and one E is eOfta. These 4 are going to be the most useful websites for a resident. Like Telegram, which is a godsend, there is another important one website which is again godsend. A highly controversial, but I want to share this for the benefit of the residents. Sci-Hub. How many of you know this site? Great. People don't talk about this, but this is the real world again. This is one article which I want to download. For 1 hour, the cost is $30. Copy the ID number, paste in Sci-Hub, I get the entire article. Education has to be for free. Okay, there are so many e-learning resources, but what is the point if you don't have it in the brain? What is the point if you don't use it in the right way? For that, note-taking is important. Take notes. And how to take notes? Use your iPad. How many of you have iPads? Okay. I tell my residents, before you get 90D, get your iPad. Because iPad is going to be an investment, but it is an investment. It is not going to be an unwanted cost. Every single book on Telegram can be got into an iPad. You can read it. So I'm just giving you one tip. Always use this matte screen protector, which will reduce the reflections on your phone, on your iPad. It will give a paper-like feel when you draw with an Apple Pencil. This is an incredible way to take notes. I'll share 2 important applications. One is Notability, which is the note which I use, an app which I use to take notes for my residency. So all my all my drawings, all my illustrations, the handouts what I give for my patients are from Notability. The books what I published on embryology are done with the help of Notability. This is again a lifesaver. Incredible, incredible application, which is only for Mac, only for iOS. But if you're using others, you can use OneNote. PDF Expert, the best in the class PDF reader. I'll just talk about one more application, which is XMind. Mind mapping is the most effective way to learn any subject. You have apps for that as well. So this is an application which I use to create mind maps. This is what I used to teach my residents. So cataract, I have made a mind map on what they should see in the OPD, in camps, about everything with regards to cataract. Now this was made possible with ease because I had to use this mind map, and mind map made it a lot more easier for me to put all the information in one page, yet make it very categorized and organized. So let's complete here. Coming back to a full circle. A small town postgraduate can now access the best-in-class information which are available across the world, which was not the case 7 years back when I uploaded my very first video on this YouTube channel, because there were not many quality material available online. But now, we have plethora of information which are available for free, which anybody equally accessible, and which are quality-driven or quality-rich. So we aspire for this free quality in education. And that is the collective dream of this incredible team, Dr. Rakhi, Dr. Hema, Dr. Prithvi, who are going to represent you guys as a community to create a world, not just online education is free, equal, and quality, but even offline academic training, which are free, or if not at least affordable, which are equally accessible for all across the state and the nation, and quality driven. Thank you so much for this opportunity. Let us all teach to reach.
Next, we have Dr. Hema on stage. So she's an alumni from Aravind itself, and she'll be sharing with us tips on how to prepare for your fellowships and how to plan your fellowships.
Good morning, all. So I hope all of you are fed up with so much of e-learning resources. Now let's come to the practicality of our residency. What next residency? Fellowships. So how many of you are damn sure that you're going to take a fellowship? Please raise your hands. No one. Okay, so all of you are, I think all of you are confused like Jagadi. So if you are a general ophthalmologist, there's no harm because you can see a variety of pathology, you can practice anywhere, and you can earn sooner. But why fellowship, if you ask me, I would tell, it will increase your significance. It's not that a general ophthalmologist don't have significance, but we are in a branch which is the branch which has grown the most among the medical field, that is ophthalmology. So it's not like our seniors. Patients prefer specialists, so it's better to have fellowships, short term or long term. If you're planning for a fellowship, you will have a specialty of interest, you will think of a feasibility, you need a support system with a family or a maid or something, if you are a female especially, and you should have a strong personality to bear with your professional and personal stress, and you should be eligible. Mainly, if you pass your DO, DNB or MS, it's enough. So the process of fellowship start with choosing a specialty. You will shortlist an institute. You will wait for the announcement of the date. You will make a curriculum vitae. You have to go through the preliminary test or final test, and last the interview. This may change from institute and institute, but this is the main protocol which is followed in the prime institutes. For choosing a specialty, I'm not here to tell you which specialty is good for you because you only have to decide which is best. But what can I tell you is that you should be passionate about your fellowship specialty and don't get fascinated by what you see in a conference, or if you see a K-Pro implant or you see a retinal implant, don't get fascinated. Be practical. You do a ground study and you see where you're going to settle, and at that place, what is the fellowship of demand, and plan like that. We have an exhausting list of institutes for fellowships throughout India and also in Kerala. You can get this, the best way to go with it is you can go to the AIOS platform, and there is a heading called Fellowship Programs. If you click the hospital, you can get the course catalog in which there will be dates of examinations, date for interviews, etc. And in this, it will be given the number of seats available each year and the person to be contacted. But the number of seats depends on each year, and the institute will decide how many candidates to be taken. So it differs from year to year. Other way is that you can go directly to the website of the institute of choice, and you can search for the dates and announcements. To summarize, the admission usually usually 6 monthly, or and it will be either January or June. Some institute takes only once in a year. So when the announcement comes is 3 to 4 months before the induction course. That is maybe September or October and March or April. So you have to go to the website during that time and see for the announcement. If you're planning for a fellowship, you have to plan before 6 months of your completion of the course. So if you are going to write in the December, you have to plan around June, July, and you have to have the plan, and before your giving exam only, you have to go to the website and apply. So don't worry about whether they will ask for your pass certificate and all. If you have passed and you have a provisional certificate also, they'll be happy, and after the admission you can produce. Most of the institute are like that. So how to decide on the institutes? You have to talk to the person who has completed or is doing the final year in the institute. How you can get that network? You can meet during these conferences like this, or you can go through your friends who has already studied. So what to ask? Don't ask this. Everyone will ask this only. Chori undo. See, this institute, they are giving their private patients to us. So they expect an amount of responsibility from the fellows, and we have to give that. So it will be tough for every person who is doing the fellowship, whether it's a small or large institute. What you have to focus is that, what is the clinical exposure, what are the present protocols, because the person would have completed 1 year or 2 years before. What is the present protocol? Is there bond? Is there extended fellowship? You have to go deep into that, because your extended fellowship may not be in the same center. It may be in the peripheral centers. There may not be person to train you during your extended fellowship. Extended fellowship is nothing but what you practice after your fellowship in that institute, 2 or 3 years. So you have to need to have a good knowledge about what you'll be doing after the fellowship during the extended period. So let's start for applying for a fellowship. The first and foremost thing is preparing a curriculum vitae. It may sound funny for you because I have put this slide, but believe me, from this, the institute decide whether they have to choose you or not. You will have to write your name, contact number, current position, etc., according, similar to all other curriculum vitae. Don't write like, I'm a hardworking, motivated, oriented, that everyone will be writing. Don't like a bluff like that. Just focus on main points. Your professional skills. If you have done, like our topic says, a small town postgraduate, you may not be having so many surgical skills or publications, but you can write like, I'm proficient in slit lamp examination, DO. I have seen SICS and done SICS or chalazion surgeries. Be truthful. I have observed TPPV, TRAP, PKP, etc. But what you tell, you should know. If you are telling you have watched TPPV, you should know the basics of vitrectomy. Research and publication. If you don't have a research and publication, it's okay. If you have, it's well and good, but you should be thorough about your publication. And if you don't have, you can discuss about your thesis. Go through your thesis. What was the result? What was the conclusion? Be thorough about that. Conference and presentations. Just don't write, I have attended KSOS, I have attended. You can write that, but you should at least remember something, what you have taken home from that conferences. Because the person who is in the panelist would have made a talk in that. He would have attended the conference. So you can tell that I attended this conference and I got these points, like that. It will show how keen you are and how truthful you are. For writing the reference, which is a must in the curriculum vitae, you can't write your friend's name or your batchmates. That person should be a senior, preferably your mentor or teacher, a person who can vouch on your character, and preferably someone who's known to the panel. It's not difficult to contact someone who has done or who has worked with the seniors in the prime institutes. And you should expect that that person will be called by the panelist. That's for sure. And you should inform that referee that you have given your name as a reference, and he can expect a call from the institute. See, for extracurricular activities, all of us will write, I like to listen to music, watching TV. You should be specific even for the extracurricular activities also, because all this institute even look at the extracurricular activities. You can be specific. I am a BTS fan, or like that you can tell, so that that person, Formula 1 follower, like that you can tell, so that the person will remember your name. So when they are discussing about the candidates, yeah, this person, that girl, yeah, I remember, she was talking about Formula 1, just for getting a notice from the panelists, that's all. But you should know what are you talking about. Just don't tell that I like BTS, and if you don't know, like me, if you don't know anything about BTS, it's a mistake. But fellowship exams, some institute will have preliminary exams, some have final exams also. They have, institute like LVPA will give their materials priorly, you have to read that, and they'll conduct the preliminary exams. But what to focus is that most of the anterior segment people will have almost one paper. All the anterior segment fellows should attend to go through that. Questions will be general, and it will be easy for persons who have finished their DNB or MS recently. If you have passed way before, you can brush up. The tiebreaker will be, they will ask about the recent advances in the specialty and the studies from the institute. Studies from the institute, pakka, you should be knowing. Next is the interview. If you have done well in the prelims and finals, they'll take you to the interview. I think there is not much to stress about. Dress code, everyone know that. Men should be in Western formals, clean shaved or trimmed with shoes. Females, preferably Indian or Western formals with shoes, no glittery jewelry, hair neatly tied. Your body language should be overconfident. No, not overconfident or underconfident. The institute mainly sees your attitude, not your knowledge, because if you have the knowledge, you won't be sitting there. You'll be practicing somewhere. You don't need a fellowship. So don't try to expose or exhibit your knowledge. They're seeing your attitude, how keen you are and how responsible you are. So they'll ask you, why this institute? Why this specialty? Some people will write preferences, cornea, glaucoma, retina. So what that gives you is that you want any of the specialty. Don't write like that. If you are asked about the preference, write 1 or maximum 2. Don't go beyond that. So that they will know that you want to get this fellowship for sure in this specialty. You should have a background checkup for this institute because they will ask about the brief. You should know the brief history of the institute. You can go to the website and there will be writings about the institute history. You can contact the other PGs or fellows from there and ask about the seniors and colleagues working there. And you should know the panelists and have an introduction about them. It's not a difficult because panelists usually will be the same every year. You can go, even from Google, you can get their work and the body of work. And go through the research or publication of the department and have the knowledge about which department you are going to take, who is the head, who are the other staff, what's their body of work. They'll also ask about your studies and publication from your institute. So you should be remembering your roots also. They'll ask questions like, one of your patient had allergy to homide, what you'll do? Your junior blocked the wrong eye, what you'll do? You observe your colleague fumbling during a step, what will you do? See, all these questions are just to see your attitudes. What they are checking is, if I am asked what you'll do, I'll tell that I'll give the drops, I'll console the patient and ask the patient to see after 3 days. They'll see how committed you are to the patient. And next, if you're junior, you have blocked the wrong eye, you should inform to your authorities. Like that, these are just examples. You can expect questions like that. They definitely will ask about your future plans. You can be truthful. They'll ask your long-term plans, personal questions also, whether you are married, you have kids, what's your plan about the kids, if you are doing the extended fellowship, what will you do with them, whether your in-laws will allow you to stay here, and about the bond, whether you're willing to do bond. Most of the institute are not having, LVPA used to have before, but since 2 to 3 months, they are not having bonds. Then they will ask whether you are willing to go for extended fellowship. If you are not willing, you can just tell that. At last, I want to highlight that a comfort zone is a beautiful place, but nothing ever grows there. So think whether you are in a comfort zone or the other side. Thanking all my previous institute and my friends who has helped me. Thank you.
First of all, over here, we need to know that one thing that publication is to show people what your work is, because that can lead to the next step, and the next step which would actually lead something important in the whole ophthalmological, knowledge pool. So it is just not important to write exam and pass, but to publish what your work is. So the first thing you need to have is an interest. So you know, a person who doesn't have interest in publication or doing some work and letting people know about his work will not be able to do this. You need to develop an interest. I was not interested in publication at all. Then I started doing some innovations, and then I got a call from my mentor. Why don't you publish this? I was like, I don't know how to publish. Like, no, you should learn how to publish, because it's your hard work which you have presented in a conference, which people around the world need to know. So you need to develop interest, you need to develop a skill on how to write these things and then publish it so that it is out there and it helps a much more bigger audience than you actually think. It's not that just for you. So I made my first publication as a Trash to Treasure Red Camp, which I've been presenting everywhere, but I would not published it. So once I published it, people came to know, and I'll tell you about that again. So first thing is to develop interest. Talk to people who are published earlier so that you get points on how to make it easier, how to publish things. And for people who have just started their residency, you can start with a letter to editor or a case report or a photo essay, which doesn't require much. It requires only 300 words. So you can start with those kind of articles and then go to the bigger original article. And having a name in a published article is a big motivation. The time when I saw my name in my first article published, I had goosebumps, like how Pranesh was saying. So this is the first article which I published, and mind you, it was the first in the innovations in ophthalmology. This was because of this article. There was a section in IJO called the Innovation in Ophthalmology, which then went on to get a best published award in All India Ophthalmic Society. And after this, a lot of people came to know about this device. They started making their own, and they've started taking fundus images. And recently concluded World ROP, people were thrilled to see something like this, because, and when I told them it's published, they all started Googling the article, they started downloading it, and now it's a big help for a lot of people over there. One thing you need to know this subject. So like Rakhi said, what the mind does not know, the eye doesn't see. So you need to have a sound knowledge of what is there, what is the knowledge pool out there. So you need to have a nice thorough literature search and find out what is there and what is not there. And on top of that, you can make a publication, which is, if you see a case, and if it's a CRAO, in a few centers, CRAO might not come very often. So you might think it's rare, but then when you go and search, there are a lot of published articles on CRAO. Or maybe you find something extra on a CRAO, and then you need to publish it. So you can find out if it is there in the knowledge pool or not, and then if it's not there in the knowledge pool, you can take it and make it into a publication. Another thing is to increase your knowledge, always try to give exams like FAICO, ICO, FRCS, MRCS, which would actually increase your knowledge about the existing pool of diseases and treatment, etc. Mentoring is very, very important, I would say. It's actually the mentor who would actually push the mentee to go ahead with his publication, maybe starting with the thesis. So the mentor might ask you to publish your thesis. He can help you with how to write it, how to prepare a manuscript. Okay, so the starting trouble can be actually taken care by the mentor. And once you're done with it, you can ask the mentor to go through and find if there is any mistake or something which can be modified. And he or she is more experienced in this aspect. He can also guide you with queries which come later after the manuscript is reviewed by the journals. So this is my mentor who actually pushed me hard to publish my things, and by now I have around 8 innovations in IJO, and it was only because of the starting push which Dr. John gave me. Otherwise, I wouldn't be able to publish all these 9 articles. So we need to have the research question. What a good question to know what you have to publish. Then documenting. So you have a case, you think it's a very rare case. What you need to do is you need to get all the investigation done. You need to document each and everything: fundus photo, OCT, anti-segment photo, corneal OCT, FFA, FAF, everything. Whatever your institute gets you, get all the investigation done if you think it's a really rare case. So this is, and don't forget to take consent. So consent is one major part you need to get from the patients. And try learning a little bit of basic statistics like Excel and SPSS software. And if you need help, you can get it from a biostatistician. So a basic knowledge of statistics is much required in doing studies and publishing it. So writing the manuscript, you don't have to do write the manuscript, the whole manuscript in one whole day. You can do it parts by parts, slowly, try to understand what is required, what is the main question is, and go ahead with it. Okay, there are, and one more thing is never ever copy anything from the previous published articles. Always type it by yourself. Don't ever, you can write it in your own words and type it, but don't copy anything from any article. There are instances where you copy it and the whole thing gets highlighted when you send it for manuscript, and then plagiarism. So don't do that. And once you've written it, you can run through it through Grammarly to get a proper grammar sense of how you have written it and corrections if you require. And then there are reference management, like how Dr. Pranesh said about the Zotero, where you don't have to manually put references. You can just include this in this Zotero app, and it will automatically refer it. And then the journal. What journal are you going to publish it? You have international, national, and state. You can go through all these journals and see if your articles can be put in these journals. It will have a certain amount of quality, and you can decide on what article type. Like I said, letter to editor, or a photo essay, or just a photo. So you can decide on the article type, the specialty you want, and it will have a journal of that particular specialty. And the more the impact factor, the better journal it is. And the quality also increases. So you need to understand where your article lies. And also check for acceptance rate. So always, if you have a very good article, try to publish it in the international journals. If not published in international, get into the national, and try to see if it is PubMed index. If it is not, and if it's not of that quality, then you can even try in state journal. And the state journal article, these ones are not actually PubMed index. There are few journals which are PubMed index. So you have to look out for all those things. So whenever you have something to publish, you need to have these things ready. So you need to have an abstract ready, a keyword, introduction, material, method, result, discussion, conclusion, references, and something called legends. So legends carry figures and tables. So these are the main things which you need to have ready in your Microsoft Word. And then always remember, never plagiarize. Try to keep the ethics. Get copyright forms and signature from all the authorship. Okay. Hope you'll all publish soon. Thank you.